Hello, everyone. So thank you for joining us this morning. I hope you've been enjoying the symposium so far, and you're joining us this morning for a look at how patient and staff experiences have changed in mammography due to COVID-19. I would like to take this opportunity to introduce you to Sally Coates, Fujifilm's Women's Health Sales Specialist. Sally has over 20 years experience working in healthcare sales and is now focused on women's health. Also joining us today is Kathleen Woodland. Cotty is the Superintendent Radiographer at Kettering Breast Screening Unit. Cotty has worked there for over 7 years and has completed further training in image interpretation and reporting in mammography and X-ray guided interventional mammography techniques. On top of all of this, Kettering Breast Screening Unit provides screening and symptomatic services to over 55,000 women, and were one of the first in the UK to introduce a contrast-enhanced mammography service as a radiographer-led initiative. They were also one of the first departments to make the required changes to restart their screening services after the pandemic hit. So welcome to Sally and Cotty.
Hi, Jill.
So
Hi, Sally.
Hello.
Hi.
We might as well jump straight into the discussion. So
Yeah, if I may, I just thought it would be helpful for some of the listeners to have an admin perspective on some of the questions that you were going to put to us. So hence, this is why we're observing our PPE here. This is Charlotte Abbott. She is our Deputy Programme Coordinator, and she's really been integral to our successful reset programme. So I just thought it would be really helpful that she could offer the insight from an admin perspective that may be useful for some of the people out there that have got some questions. So
great. Thank you for joining us, Charlotte.
Thank you.
So my first question is to you, Cotty. How did you go about finding exactly what changes were needed to be made to your screening vans and create a COVID-safe environment?
So at the time when the whole pandemic thing started, it was with great reluctance that we paused our screening programme. But almost as soon as we'd paused, we were already sort of making calls, trying to find out what can we do, sort of like anticipating when we could actually get back on the treadmill, so to speak. So one of our first ports of call was our infection prevention and control team here at our trust. And we actually invited them down, myself and my immediate manager, Deb Black, the programme manager, and we did a walkthrough on our mobile van just to show the IPC team what exactly we were doing at that time, and just looking at things and the changes that we could make to make things safe for our colleagues, and also for patients, limiting the contact. And we came away with sort of a shopping list of things that we needed to change on our vans. So pretty much as soon as they'd done their visit, we started shopping.
Great. And how long did the changes take to be made to the screening vans?
I would say we paused as of the 23rd of March, and in that first week we had meetings with IPC, our estates and facilities team, with the building guys, and just kind of looking around for suppliers to make the changes that we wanted. I have to say the estates guys here at our trust were really amazing. They really took it on board. About getting things prepared and ready, and we also wanted to put a little bit back into our community, so we didn't go with big suppliers or some of the perhaps more well-known ones in the screening world, and we actually went local. So we have a guy that does work for our main department, and he did the recovering of main ultrasound couches, so we got him involved. And he did an amazing job. He came, he removed all the fabric seating in both of our vans. He took them away, he recovered them, he brought them back, he fitted them. And he just thought it was nice with all the lockdown that, we were able to help a local business sort of stay afloat in a difficult time. And our estates team, they also contacted a local flooring company who came in and fitted the appropriate flooring for us. We did things like removing curtains. We had perspex screens installed, extra hand sanitizers. And I think one of the biggest things that we did was that we made our vans a one-way system. So that would limit patients going past each other. And we actually had a new set of stairs built at our fire exit on both vans. So the ladies would come on the van one way, straight into the X-ray room, have their mammogram, and exit via a bespoke set of stairs that were now at the fire exit. And that was all organised by our trust building services and estates and facilities. So they were really, really amazing.
Yeah, great idea there. So Sally actually has our first polling question, I believe, now. I think you're just on mute, Sally, maybe.
Mute there. So our first polling question that we're putting to the audience is, have you always had the necessary PPE available to you? So you can see the screens, the answers coming up on the screen there. So it looks like the majority is a yes, which is good. 73% yes. Still, it's quite high. I know when we asked your department, Cotty, we got 100% yes for PPE, which is good. So what I would ask you, Cotty, is how do you find working in PPE? Has it presented any restrictions?
Not in so much as physically restricting. It can be quite uncomfortable. I do biopsies as well as the reporting. And sometimes if you've got a case, if it's bilateral or you've got more than one area, you do get rather warm. And a lady of a certain age, it can be a little bit uncomfortable sometimes. But it's just, I think it's become second nature now, that gloves, apron, goggles, and it would seem quite weird not to do that now. But it was quite strange at first, especially for all the girls, because in the very beginning, for the first 3 weeks, we were told we didn't need anything. So, I mean, we were a unit that's always used gloves. I know some places don't, it's very individual. So we'd always use gloves for our mammography. And then it was, no, you don't need a mask, you're absolutely fine. And then all of a sudden, 3 weeks later, oh, you must wear a mask, and then it was visors and goggles, aprons, and we've just stayed the same ever since.
Yeah, and quick question for you, Cotty, here from Claire. She just said, have you experienced any women refusing to wear masks during the examination?
A lot less than we expected, because obviously there's been a lot of this COVID deniers, movement. So we did think that we would get a lot of that. And to be honest, I think we've had about 2, and just sort of some gentle conversation with them, just to find out any particular reason why. Do you have an underlying medical condition? And we do have spare visors on the van. And we've said, well, would you mind wearing a visor? We respect your opinion, but we have to think of the safety of our staff also. So there's not been anything untoward with that, but I literally think there's been about 2, and one of them was a lady with a medical condition. She had COPD and she found it quite restrictive. Sure. So we've been quite lucky.
What about with regards staff illness? Have many of your staff actually had COVID or been off with COVID?
So in the first wave, we had one of our consultant radiographers. She was off for 4 weeks. She was COVID positive, but she had some other underlying health conditions, so it wasn't a very pleasant experience for her. And currently, at the moment, I've got two clinical staff who are COVID positive, and they've been off for almost 4 weeks each now.
Okay. And what about with regards to the vaccine? Have you all had your vaccines now?
I think we've pretty much had, haven't we?
Pretty high uptake, haven't we?
About 100% uptake. There's only been obviously the people that are off on sick leave at the moment, but we've been quite lucky, and everybody was quite eager to get them. So we've all been Pfizered here in this department.
That's good.
And I think our trust has just recently moved on to the AstraZeneca vaccine for patients that are coming in for their appointments.
Sure. Okay, so I'm just going to hand over to Jill for the next polling question.
We wanted to see out there, were any colleagues in your department redeployed? So all the polling questions are popping up here, but if you look at Fujifilm question 2 there, were any people in your department redeployed? So I can see the responses, got about 84% saying that yes, some people were redeployed. So it looks like only a few departments that didn't sort of lose any of their staff to other areas in the hospital. Were your staff redeployed at all at Kettering there, Cotty?
So in the first wave, we all went across to our main department just to do a little bit of refresher training. It's been a while for things like chest x-rays, because we just didn't know how our main department colleagues would be affected, whether they would need any support. So we did our refresher training, and but fortunately none of us were redeployed from our unit. But we share the ground floor with our preoperative nursing team, and they were pretty much all redeployed to help out in ITU and different other ward settings. So
yeah.
So I'm just reading some of these questions. Just bear with me. One-way system.
So are you finding women are attending screening appointments, and what is your attendance rate like at the moment?
Okay, our ladies, I think, have been really grateful that we're actually still doing the screening, and they were like really surprised when we started getting back in touch with them, and I think they were really grateful for that. So obviously there has been a drop in the attendance. I think that's been seen nationally. So I'm just going to hand this over to Charlotte, because she's got more information on that.
So yeah, with regards to our uptakes, I mean, here at Kettering, we do generally have a really good uptake rate. It has dropped around about 10%, and I think it's been a combination of things like the open invitation system, alongside obviously ladies being nervous to come along and have the screening done. Up until December, so up until the most recent lockdown, we were finding that a lot of people were making contact, coming along and attending their appointments, but we have found a little bit of a drop-off since this most recent lockdown. And to be honest, I'm sure Cotty will agree, for our particular area at this time, during the first lockdown, I didn't feel as an area we felt massively affected by it.
No.
This lockdown that we've most recently gone into, we definitely felt the difference, haven't we, with regards to local positive rates. So that's definitely had an impact with regards to the amount of ladies wanting to come and have the screening. But we're very encouraging the staff on the phones and things, try and explain that obviously they can still make contact with us to rebook an appointment within the next 12 months. So, and most people that we speak to are quite, receptive to that and do want to still come and have their screening done. It's just that at this time they don't feel that they, want to come along and have that.
Yeah, great. Thank you, Charlotte. And we're getting a lot of questions here in the chat from people watching about appointment time. So if we can go to that polling question, please, to see what appointment times you're looking at in your department at the moment. So that's the Fujifilm question 3 there you can see on the screen. And so talk us through what happened with your appointment times when you made these changes and started screening after it.
So in the first wave, obviously with all the new changes that we'd made, our one-way system on the van, we weren't quite sure how this was going to translate into real life. So just to give us a little bit of latitude, we increased our appointment times just to 20 minutes. because we weren't sure how long donning, doffing, PPE, cleaning, how all that was going to how that was all going to work. So we started off with 20 minutes, and we quickly found out that this was absolutely far too long, and it was quite tedious because you were waiting around a lot of the time. It was also a process that kind of evolved as well, and I think because we wanted to give the girls, the mammographers who were doing this work, some ownership of this whole process to make them feel involved. We kind of said, look, there's no right and wrong way of doing this, as long as we maintain to the principles of the social contact, reducing that, and the PPE, social distancing, etc. So it was kind of a system of how they got the ladies on the van, how they got them in the x-ray room, how they did their cleaning. That process, they pretty much designed it and ran with it themselves, and it works really well. I can see someone's been asking about the temperature checks. Yes, we zap all of our patients before we let them onto the van, and we just ask them a couple of questions as well. So, but we pretty much have one lady on the van, and then as soon as that lady starts exiting through our bespoke stairs, then the next one is coming on. And we've actually got our appointment times down to 10 minutes, and that is sufficient for us to be able to do this and do all the necessary cleaning, because we've minimised their contact and touching of anything on the van as well.
We also, just to kind of back that up, with any information we send out to the ladies, we make sure we include some local guidance. So all ladies are aware that beforehand they've got to wait at the bottom of the steps for the unit, that they'll be called up, temperature taken, and obviously if they've got any questions with regards to that, they've got a number they can make contact with us on. So I think that kind of heads up, and if they've got any questions, has been quite good to ensure that when ladies do turn up, it flows quite nicely.
Mm.
That's great. And are most women actually attending their appointments? Is everyone showing up? I think you've mentioned to me previously that you did pop the over 70s at risk group on hold. And are
Yeah, I
most
mean,
of your women attending
obviously with the
now?
implementation of open invitations, we're finding that with the open invites, if it's one of our open invite clinics, ladies are obviously all attending. The way we've done it at Kettering, rather than going to all open invites for all of our ladies, we're actually running sort of two systems at once, so a bit of an ad hoc. So for one batch, for one GP surgery, we're offering timed appointments, and for the other, we're offering open invitations, which again has actually been quite helpful for us to monitor things like uptake and be able to kind of see whether the open invitations has had an impact. So yeah, going along that sort of experience and that side of it, it's flowed quite well. It is working, and our uptake for our open invites has been really, really good. Timed, I'd say around about that 60 to 70% are actually turning up for their appointment times.
I think one of the reasons we wanted to do a little bit of a mix and match approach is that we, as a department, we were a little bit concerned about health inequalities. Because we wanted to consider people, the ESOLs that are not English speaking as their first language. If they got a letter asking to make contact, would they understand? Would they feel confident enough to make that contact with us? My own background is from a different ethnicity, and I know that from experience from relatives, they'll go to an appointment if they're sent a letter because they've been told to at a particular time. So, and I think that's why we did the timed thing as well. So to try and scoop those people that might otherwise think, I don't understand what these letters are for, I'm not going to ring, I don't feel confident. So that's why we did that, to try and sort of promote inclusion across all ethnic groups as much as we could.
And we have done a lot of work as well with regards to trying to maintain our uptake. So once we send out that initial open invite letter, we're using a new SMS system that then sends a reminder out to them. And then once, if somebody hasn't made contact, we send another letter out to them, just kind of giving them the opportunity to make contact again. So utilising things like our SMS, we've updated our web page, and we've actually now got a change of appointment function on there. That came about in October, and we've actually already had nearly 200 responses just to that alone. So I think, although COVID's been a massive negative, we've managed to pull quite a few positives from it, to kind of bring us up to date with some of the ways that we do things, which actually has been really, really good for our department.
Thanks for that, Catty. Just the last few questions here, and thank you, Charlotte, as well. Are you texting and do you use Facebook?
We have got a Facebook page for the trust, and obviously if we want any notifications or anything going out, we can do that. Predominantly, we're sending our text messages out. Any timed appointments, we send a reminder 3 days before the actual appointment. Like I say, on the open invites, we're sending a message out to them, reminding them to get in contact. It's also been really useful for any clinics we've actually had to cancel, that it's another way of getting in touch with ladies to let them know that we've had to reschedule their appointments. And our web page, that's all been, like I say, just recently updated, we include on all our letters all of our information. So again, people that can't catch us between the usual 8:30 till 5 have got another means to be able to make contact with us.
Sure. And then just the last question, I think it'll have to be for time. I'm not sure, did you mention about the ladies undressing in the x-ray room? I know, Cotty, that's something you'd said to me that the ladies were having to do to keep the appointment times down.
Yeah, so what we do after we've zapped them for their temperatures, we get them on the van. We're not putting them in cubicles. We're not getting them changed in cubicles, just to limit their actual physical contact with the van. And we remove the curtains. We have one that's got the antimicrobial curtain there, just in case, to say if somebody became faint or something like that, that we would have somewhere that we could go. But we actually get our ladies undressed in the room, and they quite like it actually, because they're sort of, everything is wipeable. They put their clothes on the chair, and it's all there. And we've got the dispensers on the wall. They're sanitizing their hands, and I think they actually quite like it, rather than sitting in a cubicle, sort of waiting to be called through. And certainly, we've not had any negative responses from any of the ladies.
I was just going to say, we've just launched our patient satisfaction survey, and that's actually something that's come up on the survey, that actually a lot of ladies that have previously been for screening prefer this new way of doing things, this kind of coming through and getting changed and unchanged within one room, and kind of dealing with some of those questions and things. So actually a lot of them have come back. We've had about 3 responses positively talking about the new system and how much they actually like it.
Brilliant. Thank you both. Thanks for sharing your experiences.
That's great.
You're welcome.
Thank you.